Hello and welcome to this edition of Casa Care Talk. My name is Tony Herrera and I'm the Payment Innovation and Transformation Director here at Keck Medicine of USC, responsible for the deployment of value-based payment programs such as bundle payment programs. Today I'd like to talk to you about the importance of staying current on how the healthcare industry is deploying these programs, such as bundle payment programs, and more importantly, what hospitals who are taking on this risk will rely on home health and skilled nursing facilities to help them reach their value-based goals. As payers and the government begin to transfer risk to providers, providers will not only be responsible for efficient quality healthcare within their four walls, but they're also going to be responsible for the post-acute care cost and care that their patients they are referring to your facilities are getting. This is certainly evident with the bundle payment programs that CMS has deployed, especially the Comprehensive Joint Replacement Program, where the hospital is responsible for not only the anchor inpatient hospital stay, but they're also responsible for the patient care for up to 90 days post-surgery. What does this mean to you? It means that it's important for your organization to work collaboratively with these hospital systems to develop relationships that are grounded in transparency, that are grounded in collaboration, and that you show to them that you have an increased focus on not only efficiency, but also quality, which is incredibly important for these hospital systems. This is also an important point. As hospitals continue to excel and perform well in these CMS government programs, they're going to want to leverage these learnings and apply them to commercial bundle payments with big box payers such as Cross, Shield, United, and so on, but also directly with self-funded employer groups who are looking to help control their costs. Bundle payments are an incredibly good way to do that, and the value of these bundle payments is beginning to grow as they establish themselves even more. This means that hospitals will have the opportunity to directly potentially contract with post-acute care providers. And if they're able to do that, you have to keep in mind that hospitals are going to choose high-value, high-quality providers who are helping them or are going to help them decrease their costs, increase quality, and stay within the targets of the bundle payment that they're at risk for. So it's important that you continue to show your commitment to quality and efficiency. What I would do is I would encourage you to build these relationships, if you already haven't done so, with these hospitals that are in the value-based world and that are developing value-based strategies, and be keenly aware as to what their risk is. And how you can help them manage that risk in the post-acute care setting. There is a lot that your industry can do to help a hospital system help control costs and increase quality. So it's important that you get in front of them and show them what that is. The other thing you need to consider, and that I would consider, is looking around who those hospital systems are using for their admission discharge, in other words, ADT providers are. These ADT providers offer an incredible amount of value, I think, not only for the hospital system, but also to your post-acute care industry as well, because anytime a patient lands in a post-acute care setting that is one of our patients that's part of a bundle payment, I will get pinged, our system will get pinged, and we will be told that they're at SNF XYZ, and that gives us the opportunity to reach out to that patient and continue to manage their care in collaboration with you. Now, conversely, if one of a patient that has been to one of your facilities ends up back in our hospital system, or any other hospital system for that matter, you will get pinged and you'll be notified that that patient is now at hospital XYZ, and that'll give you the ability to reach out to that patient, let them know that you know they're there, let them know that you have taken care of them before, and that you want to take care of them should there be a need when they leave the hospital. So it's important that you start looking at who these ADT providers are, and again, more importantly, what ADT providers that hospital system uses. Finally, what I would encourage you to do is absolutely be proactive. Get in front of these hospital administrators and share with them what your value proposition is, what you have done in the value-based space, or what you could do in the value-based space if you're not already participating in that. And show them that you are an efficient quality provider, and that you show them that you understand the needs that that hospital has, when it comes to bundle payments, and how you can help them reach their value-based goals. I think any collaboration that you're in, absolutely go in there in the spirit of transparency, in the spirit of collaboration, and then what I would also encourage you to do is to share best practices with the hospital, but also amongst yourselves in the industry. There is a tremendous amount that you can share. Now, this may seem a little bit counterintuitive because you're saying, why should I share this with my competitor? I would do it only because I think that you can learn a lot from your competitors as well. This model is a model that has been used in the past, where there's a collaborative where competitors come in, share their best practices, and are able to help the industry grow as a whole. I really hope that these quick tips are helpful for you. I would encourage you to again reach out to these hospitals, and I'd be more than willing to continue the conversation on a one-on-one basis if you'd like. Thank you for your time.